In this podcast, we will be discussing anxiety and general mood as it can relate to a cancer diagnosis. We have Carolyn with us today to better help us understand mood and anxiety as they can relate to a cancer experience. It's scary to receive a cancer diagnosis. You may be afraid or worried about a number of things, such as feeling sick or looking different, being in pain, taking care of your family, paying your bills, keeping your job, or the possibility of dying. Information can help to calm fears. Knowing what to expect can help to reduce worries and help you to make better long-term treatment decisions.
Well, there are different ways to think about anxiety. Generally speaking, anxiety is an emotion, and it's characterized by a few different things: feelings of tension in the body, worried thoughts, particularly thoughts that repeat or come back again and again, and physical cues such as increased blood pressure or increased rate of breathing, things like that. But here I think it's important to distinguish between stress and anxiety. Feeling stressed or nervous isn't always a bad thing. In fact, our nervous system is designed to respond to stress in specific ways. It can activate the mind and the body to perform a task like taking a test or meeting a deadline. But anxiety can become problematic when the response is too strong, or when it's turned on too easily, or when it becomes chronic. In other words, when it doesn't get turned off. Common symptoms and signs of anxiety, and those can include restlessness or just feeling edgy, becoming tired easily, or persistent fatigue, difficulty concentrating. And that can also appear as memory or attention problems. Sometimes people feel as if their mind is going blank, irritability, muscle tension or headaches, and especially sleep problems like trouble falling or staying asleep, or having sleep that's just not restful. Well, I think fear is a big one. Many people also feel sadness or anger. Feeling overwhelmed is common. And depression, too, or feeling down or disinterested or just unable to enjoy things as they used to. Many people also feel like they're losing control, and losing control in different ways of their health, of what they thought their life would look like, of certain goals and priorities. So adjustment to all of this is a process, and it takes time. There are several warning signs to watch out for. So things like being unable to eat, or being unable to sleep or fall asleep, lacking interest or your ability to find pleasure in activities that you used to enjoy, experiencing emotions that interfere with your day-to-day activities or things that last more than a few days. Another thing people experience is just feeling numb, feeling helpless or hopeless, having a hard time finding meaning in things. Like we said before, difficulty concentrating or feeling kind of scatterbrained. Certainly crying for long periods of time or many times each day. And certainly if you're having thoughts about hurting yourself or committing suicide, please call your doctor right away or visit the closest emergency room. Well, everyone has their own way of coping, and there are lots of different tools. One is really to start thinking about what's helped you in the past in difficult times. Most likely you already have resources close at hand, both within you and in your day-to-day life. But asking for support is important, and I know it can be difficult, especially for those who have a caretaking or caregiving personality. But this is a crucial step to learn how to accept and receive support from your family, from friends, and from people in your community. And it can be helpful to think about being specific in how to ask for help. This can avoid kind of getting attention or advice that aren't as helpful. Other strategies are things like spiritual connection. Some people use prayer or meditation or just other practices that help you feel connected or more at peace. And you may want to use the guidance of a chaplain, a pastor, a rabbi, or some other leader that's important to you. Also very important to pay attention to your physical needs. Things like rest and nutrition and other self-care become really, really important. And for some, that may mean slowing down, kind of cutting down on your personal commitments or letting go of expectations of what you used to be able to do. And some people find that they really need to express how they're feeling, whether that's through talking or listening to music or painting or writing. I know journaling can be a powerful tool for some people, and that's a place you can kind of put anything down without holding back or worry about impacting somebody else. Movement or exercise. I know it can be difficult, especially when dealing with some of the side effects of treatment, especially fatigue. But it can be really helpful, and it is important to talk to your care team, of course, about your plans before starting a new program. But other things, you can use professionals. Consider meeting with a music therapist or an art therapist. And for a lot of people, just talking to other folks who have the same type of cancer is incredibly powerful. So whether that's through support groups or online chat rooms, there are other programs that do one-on-one matching, so you can just talk to one person who's been through a similar experience. All of those things can be very helpful. A few things to avoid, just a couple pointers. If you can, try to let go of the pressure to be positive all the time. That's just not possible and not always very helpful. And try to avoid being isolated. People do better when they feel connected and not so alone. Well, we hope that oncology social work can be a good resource. We have a large team here at Swedish, and we work closely with the medical team. Things that we address are kind of psychological and emotional aspects of diagnosis and treatment, kind of helping people adjust to the new reality that they're facing. Communication and relationship issues are another thing that we support, and looking at practical matters too, financial concerns, billing issues, things having to do with your job or your school, things as simple as transportation. Your medical team can answer a lot of questions and help to increase your understanding of what's happening. Certainly, getting connected with a psychologist or a counselor can help you sort through your emotions in a deeper way. And it can be helpful maybe to find somebody who has experience working with cancer or with chronic illness. So the social worker can certainly help get you connected. So a lot of times members of a faith community or spiritual community can help with the deeper questions of what does this mean and why me? Challenging belief systems comes up for a lot of people, and thoughts you have about death and dying.
This concludes our podcast. Please remember that during your cancer experience, we want to ensure you are receiving the support you need. If you're experiencing any of the symptoms discussed, we encourage you to discuss them with your healthcare team.